Hello, I'm Michael Brown, president of the School for Advanced Research in Santa Fe, and it is my great pleasure to host this webinar, which is part of our Creative Thought Forum series. The Creative Thought Forum series at SAR is made possible through the generosity of our members, as well as our President's Circle and Founder Society. We'd be delighted to have you join us as members. You can go to our website for information on how to do that. Before I introduce Hugh Gusterson, our speaker today, a couple of matters of format. You'll see that there's a panel typically to the right of your screen. In that panel, you can submit questions, and we will process the questions. Obviously, we want to avoid redundancies and other things. So when Hugh is done speaking, which will be roughly for half an hour, we'll have an opportunity to pose those questions to Professor Gusterson. I'll be joined in that part of the event by Paul Ryer, who's the head of scholar programs at SAR, and we'll be doing a tag team questioning of Hugh Gusterson. Hugh is a professor of anthropology at the University of British Columbia, Vancouver, with a PhD from Stanford University. He writes about nuclear culture, drone warfare, counterinsurgency, international security, and ethics. He was a Weatherhead resident scholar at SAR in 1991, 1992. His books include Drone, Remote Control Warfare, People of the Bomb, and Nuclear Rights, which is a study of a weapons laboratory at the end of the Cold War. He's a regular contributor to the Bulletin of Atomic Scientists and Sapiens, and his essays have appeared in the Washington Post, the LA Times, Boston Globe, San Francisco Chronicle, Science, Nature, and New Scientist. He recently was awarded the Anthropology in Media Award by the American Anthropological Association. From 2015 to 2017, he served as president of the American Ethnological Society. So I'm going to darken my screen and do the handoff to Hugh Gusterson.
Thank you very much for that very generous introduction. Sorry, just getting my slides in order. It's an honor to be invited to speak to the School for Advanced Research. It would be lovely to be in Santa Fe in person, but failing that, I'm happy to be here virtually and look forward to hearing people's questions. So the comments I'm about to make about COVID and culture will obviously have a sort of improvisational nature to them. They don't come out of sustained research on COVID. They come more out of being an informed anthropologist who, like many of you, I'm sure, reads the newspapers and consumes other media and tries to make sense of what's happening at this strange moment in the planet's history. Michael mentioned that I have a regular column for Sapiens. And in that context, I've written a number of articles about COVID, trying to make sense of the pandemic as it unfolds. And so the talk that I'm giving emerges out of those articles. So let me begin by showing you a map. This comes from Johns Hopkins University, which is probably the best source of statistical information. It shows in red here, the more red a country is, the more intense the pandemic is there. And so you can see what's quite striking and maybe counterintuitive to many people is that Africa seems to have been spared the worst of the pandemic, some parts of Latin America as well, but Europe and North America have been hit particularly hard. So one might have thought the global South would be most vulnerable. What I want to talk about here as an anthropologist of America, of the United States, is the dynamics of the pandemic in the US and what the pandemic might have to tell us about the US and how the pandemic might change American society. This is also from Johns Hopkins sort of dashboard, and it shows you deaths by country. This is, if you like, a league table, though it's not a league table that you want to be at the top of. And it shows that the country that has endured the most deaths from COVID-19 is in fact the United States, with almost 240,000, followed by Brazil and India, Mexico, and then the country of my birth, the United Kingdom, Italy, and France. So when I see this, the question that comes to my mind is, how can it be that the country that has a predilection for lecturing other countries around the world for how the global order should be run, telling developing countries how to develop properly, telling people how they should go about engineering their public health systems and so on, how is it that that country is having among the worst experiences with the pandemic on the planet? Anne Applebaum, media commentator, said, epidemics, like disasters, have a way of revealing underlying truths about the societies they impact. And so the question for us is, what underlying truths about the United States might we unpack from the United States experience with this? So what does COVID teach us about society, especially US society? I think since the beginning of 2020, we've learned, if we didn't know already, that the United States has a deeply fractured public healthcare system. If you're fortunate enough to earn a lot and have very good health insurance, you'll get some of the best healthcare you can get anywhere on the planet. But millions of Americans have no healthcare or very poor access to healthcare, especially once you add in co-payments and so on. So it's delivering extremely unequal outcomes that are resulting in lots of cases of infection and death. There are racial and class inequalities, and I'll talk about that later in the talk. Enormous disparities by race in the death rate. We've learned that the United States is a society that at the rhetorical level claims to prize its elderly, but in practice often neglects them, offshoring them, if you like, into facilities for the elderly where they get substandard care, facilities that were completely unprepared for the tidal wave of the virus, and a number of elderly people succumbed. We learned that we're a politically polarized country, where Democrats and Republicans may perceive the pandemic in fundamentally opposed terms. And we learned that the United States is becoming a post-truth media environment, which is profoundly interfering with public health messaging and corralling the population, if you like, into behaving in responsible ways that would help limit the pandemic. So what I'm going to do in the remainder of this talk is I'm going to address three themes one by one. The first theme I refer to as imagining the real. I'll explain that in a minute. Then in the middle of the talk, I'm going to talk some more about inequality, the social contract, and what I called in a recent article, COVID Darwinism. And then finally, I'm going to say a little bit about magic. So I borrow this term, imagining the real, from the distinguished psychiatrist Robert J. Lifton. Robert J. Lifton has mainly written about nuclear weapons, though he's also written about PTSD among Vietnam vets. And his whole argument about nuclear weapons is that we are psychically numb to them, and it's hard for us to really cognitively process the threat that nuclear weapons represent because we can't see them. They've only ever been used once or twice in 1945. So for most of us, they've never been used in our lifetimes. We sort of imagine them through descriptions we might read or through dramatizations on television. But he says that if we are to grapple with the threat nuclear weapons represent, we have to imagine the real threat of nuclear weapons that is invisible. And I would say that the coronavirus poses a very similar kind of dilemma for us. It's something that is invisible. It can't be seen. People die out of sight. I think the lawyers of American hospitals have insisted that media not be allowed into the hospitals because they're worried about liability. So we've largely been denied imagery from within hospitals. And the fact that funerals have been locked down, that many people have not been allowed to attend funerals in person, only makes it harder to imagine the full scale of the pandemic. It's also hard to understand the threat that the virus represents, given that so many cases, maybe as many as 40%, are asymptomatic, so that people may not even know that they have the virus, and yet they infect other people. And for those who do come down with it, for many, they experience it like having a cold or a flu, if they're fortunate. And it doesn't have the kind of spectacular symptoms that some earlier plagues had, smallpox or plague, where people's skin would erupt in boils and red spots and so on. You just see someone blowing their nose or coughing a little bit. We're quite used to being surrounded by people like that. So it's hard in our immediate environment to perceive the threat if it is present. Whether the threat is present or not, the environment looks the same to us. And it's hard to grasp psychologically the magnitude of the threat it represents. And I have this quote here from Albert Camus, who argues that this is true in a sense of all plagues. In his famous book, The Plague, he said, a pestilence does not have human dimensions. Sorry, I'm having a hard time reading this because my little screen has covered it. So people, something themselves that is unreal, it is a dream that will evaporate. So there are ways of making an invisible threat real. One way is through imagery from hospitals. This image on the right is actually ironically taken from China. If you search for images of COVID cases on the web in hospitals, you may find more from China than from the US. I did have a video clip I was going to play you from a remarkable Cinema Verity documentary that recently came out called 76 Days. It takes you inside the Wuhan hospital during the lockdown and the pandemic. But we couldn't make the video work. But if anyone's interested, I can get you the URL for that afterwards. I found myself, I've been very affected by images like the one on the lower left. These are images of healthcare workers whose faces have been injured by the N95 masks that they have to wear for maybe 8, 9, or 10 hours at a time. Although it's not a COVID patient, it's not a dead body, it's not someone dying, I find that there's something about that image that transmits the sense of sort of being overwhelmed in a hospital emergency room and the sort of panic that goes with the pandemic. Another way of trying to make the virus real, of course, is to show images of the virus itself, like the one at the top left, which has also appeared on many murals, like the one on the top right, which is from Nairobi, or the one on the bottom left, which is from Vancouver, I'm speaking to you right now. This is a tiny virus that can't be seen with the naked eye, but these are attempts to help us visualize what it is that might invade our bodies and wreak havoc with our immune systems. Another way of making an invisible threat real are dashboards. And these dashboards in various forms have become quite popular now. This is the dashboard this morning from British Columbia, where I live. It's more complicated than some dashboards are, but it shows you for the province which parts of the province are more dangerous than others, cumulative infection rates, death rates, the numbers currently in hospital, and so on. So for many people, the way the threat of the virus is made real is through statistics, and often those statistics are put into visual representations. It's hard to apprehend just raw numbers. If they're put into charts or graphs, it's easier for people to understand them. The problem is that after day of these kinds of dashboards, I think people become numb to them. There's a funny way in which they're supposed to alert you to danger, but instead they can normalize the threat and make us accept it as part of the background ambience. Especially in the early days of the pandemic, we saw a lot of curves, in particular this curve, lecturing people on how the curve of infection could be flattened if people adopted social distancing kinds of measures. So you see the light green curve is the spread of infections over time if people take precautions, whereas the dark green curve that goes up very sharply and overwhelms healthcare systems is if people don't take precautions. So these are all visual devices to try and help people to imagine the real. Another way of imagining the real is for global leaders to talk about the threat, to talk about it consistently, and to set an example. So on the left here, you see Macron, the president of France, shaking hands with the president of Slovakia, who has a very stylish mask that matches her dress. And on the right, you see the Prime Minister of Canada, Justin Trudeau, all setting a good example by having masks. Many Canadians commented on Justin Trudeau's hair. He wanted everyone to know that he was not breaking the rules and getting a haircut. So he had this sort of shaggy look. So this is one way that leaders can help to make the threat real and to set an example. On the other hand, you have the United States. Ways of making an invisible threat confusing. So you have the head of the CDC, the heads of the task force, Fauci and Deborah Birx, cross purposes with President Trump and McEnany, the press secretary, and this sort of cacophony of contrary messaging and cross messaging. So this is exactly how not to help people imagine the real threat of it. So a result of the cacophony of cross messaging in the United States is an outcome like this, that shows that Democrats and Republicans have quite contrary perceptions of whether the worst of the pandemic is behind us or ahead of us, with 58% of Democrats believing the worst is ahead and 56% believing that the worst is behind. And I had a little video that I'm not going to go to again for the same reasons. This is a very cool video. I'm sorry I couldn't show it to you. It shows you all the American states and their color coded for whether they are blue or red states, Democratic leaning or Republican leaning. And then it shows you over time them sorting themselves out according to the prevalence of COVID. And you see all the red states just move to the top of the table and all the blue states move to the bottom. So it makes visually, transparently clear that living in a state run by a Republican governor and legislature is actually a public health hazard in terms of COVID. That people are failing to imagine the real threat of COVID, or they're deciding that other priorities are more important to them. But the visual device makes very clear that you're much, much more likely to catch COVID if you live in a red state. And then there's the question of how to actively unimagine the real. And the Trump administration in the last 3 or 4 months has actually been putting an enormous amount of effort into trying to help us to unimagine the real. And this is not unique to coronavirus. There are other things that the United States has normalized not collecting data about, trying not to think about. So thanks to NRA lobbying, for example, we don't collect comprehensive statistics on gun deaths. We don't have a federal database of all the people killed by the police. We don't have good statistics on the number of migrants who die crossing the border from Mexico. Heat wave deaths tend to get undercounted as well. And there's great work on all of this by Lawrence Ralph, the anthropologist who's written on police violence against African Americans. And Gabriela Soto and Jason DeLeon have written about migrant deaths. And Gabriela Soto has a recent really good piece in Sapiens, talking on the basis of her work on the undercounting of migrant deaths, how she's seeing the same thing with the undercounting of COVID deaths. Then Eric Kleinenberg has a wonderful book called Heatwave about the deliberate attempts by the mayor of Chicago back in the 1990s to make sure that the people of Chicago did not know how many people were killed in the heat wave there. And Kleinenberg manages to do some extraordinary police work to get underneath that. So how do you actively unimagine the real? You slow down testing. You stop state health departments reporting their data to the CDC, which has now happened in some cases. You tell migrants that they have to wait to be processed on the Mexican side of the border, not the US side. And then their deaths count to Mexican statistics, not US statistics. When important people get infected, like Mark Meadows, the chief of staff in the White House, you try and keep it secret. You hold enormous political rallies where people don't wear masks to convey the illusion that nothing is different from normal. And the CDC, which is supposed to be a federal agency at the disposal of the American people, you have it withhold its data so that the New York Times actually has to sue it to get detailed data about coronavirus deaths. Okay, so moving on to the middle part of my talk, I want to talk about inequality, the social contract, and what I call COVID dominance. These are data from the New York Times from July 5th, the most recent I could find there, on the racial breakdown of infections per 10,000 people. And you see here very clearly that African Americans and Latinx Americans are overrepresented in coronavirus infections. These are statistics for deaths per 100,000 people by race and ethnicity. And you can see that African Americans and Indigenous Americans and Hispanic Americans have much higher death rates than whites. This is a little map of Washington, D.C., where I lived until August. It probably won't surprise you to know that wards 8, 7, 5, and 4, which is where all the infections are concentrated, are overwhelmingly Latinx. So what are the reasons for these asymmetries? Well, poor people and people from ethnic minorities tend to have poorer access to healthcare. If they're undocumented, they may be afraid of getting healthcare. They tend to have jobs that make it hard for them to work from home. And we've seen sort of super spreading locations being places like meatpacking plants, prisons where prison guards are exposed, Amazon warehouses, hospitals where nurses are exposed. There's high incidence of COVID among bus drivers. So all these quote unquote essential workers are taking one for the team, if you want to think of the country as a team. People from ethnic minorities and poorer communities disproportionately rely on public transport, where they're more likely to be exposed. They live in crowded housing, where if someone is infected, it may be impossible for them to isolate. Many stories of people actually trying to isolate themselves for 2 weeks in a bathroom, because it's the only room where they could do that. And ethnically minority neighborhoods are more likely to be food deserts, and along with poor access to good, healthy food, people are more likely to develop diabetes, asthma, hypertension, which are all comorbidity factors for death from COVID. I think also looking forward, we have to think about the consequences in the future of the lockdown. This is Didier Fassin, the anthropologist at Princeton. And he said, the question we must ask is the following. Is it even true that we are saving lives? And if so, which lives? He's asking, is the lockdown saving lives? In other words, there are two interrogations. Who is excluded from this process of saving lives? And that's what I just addressed by showing minorities are disproportionately vulnerable. And then how many lives will be lost because of the consequences of the confinement? And there he is referring to the disproportionate burden of unemployment, wage loss, eviction for people in ethnic minority groups and in poorer communities. And we can imagine that in subsequent years, we will continue to see higher death rates among people who lost their jobs and their homes because of the economic consequences of the pandemic. So I want to talk about, very briefly, 3 emerging principles of stratification in the context of the pandemic. One is what the historian Catherine Olivarius calls immunoprivilege. I have immunoprivilege. I'm not sitting in a room with you all, talking to you, taking the risk of catching the virus from one of you. I work by Zoom. I teach by Zoom. I only go out to get groceries. I have access to good health care, and probably I will have earlier access to the vaccine than many people from minority and poorer communities. So immunoprivilege is one component of an emergent sort of archaeology of stratification. There's also what I referred to in a recent article as COVID Darwinism. And in that article, I quote Dan Patrick, the deputy governor of Texas, who says, as a senior citizen, are you willing to take a chance on your survival in exchange for keeping the America that all America loves for your children and grandchildren? And if that's the exchange, I'm all in. And when he said this, many pundits on Fox News said, wonderful, this is exactly how we should be thinking about things. What he's talking about there is undoing the Fordist Compact from the Great Society years, really, where younger workers take it upon themselves to look after their elders who have now retired and are thought to have earned um, sunset years of comfort and reasonably good health, guaranteed by Social Security and by Medicare. We're talking about a very different principle of organization for society here, where it's the survival of the fittest. And if the elderly are too weak to survive, then they may have to be sacrificed for the benefit of others. And then the third emerging principle of stratification is COVID nationalism. And we see this most clearly in terms of vaccine access. It looks now as if we're on the cusp of having a good vaccine become available, maybe in the next couple of months. Already, wealthy nations with 13% of the global population have bought a disproportionate amount of vaccine supply. I learned today, reading the Washington Post, that the US has a deal to buy 100 million doses of the new Pfizer vaccine immediately. The European Union has a deal to buy 200 million doses of the Pfizer vaccine immediately. This means that countries like in Africa, in Latin America, in poor parts of Asia, maybe second, third, or fourth in line when it comes to getting access to the vaccine. But also 100 million doses of the vaccine is not enough for all Americans. So who will be first in line? Will the order of the queue be according to the risk that people run, or will it be according to their socioeconomic privilege? I'm afraid to say that I suspect it will be the latter. Okay, so finally, let me say a few words about magical thinking in the context of the pandemic. I wrote this article back in May for Sapiens on COVID-19 and the return to magical thinking. And in my mind, the pandemic led me yet again to question Weberian narratives. These are narratives from sociologist Max Weber about how history is the story of the increasing disenchantment of the world. According to Weber, as society progresses, as capitalism progresses, as science progresses, we become more bureaucratic, more rational, and less magical and enchanted in our thinking. And I think that if we weren't skeptical of this argument before, COVID has given us ample reason to question this narrative. We see a sort of secondary epidemic of magical thinking in the United States and in other countries as well, not just the United States. And this magical thinking is overtly religious, but it also takes the form of pseudoscience. So in terms of overt religious idioms, there's this quote from Donald Trump: "It's going to disappear. One day it's like a miracle. It will disappear." So the language of miracles has been quite widespread, particularly among evangelicals in the US. You see this image of a truck that says, "Jesus is my vaccine." Unfortunately, I can't show you this video clip, but if you could see it, it would show Kenneth Copeland, who is a celebrated televangelist, and together with a group of other evangelists, you see him in the video casting out the virus and announcing to his viewers that the virus has now been stopped, that he's managed to exorcise it using the magic of God, if you like, to prevent it from infecting Christians. Alas, we've seen quite high infection rates in evangelical churches in particular, where people ignored instructions to socially distance. Choirs in those churches have been super spreading events in many cases. So you would expect to find magical thinking in the context of religion. But also there's been what we might call pseudoscience. On the left here, you see Alex Jones's website. He's selling colloidal silver, which is supposedly a magic silver bullet to protect people against COVID. On the right, hydroxychloroquine, which a number of people, including President Trump, have been touting as a way of protecting yourself from COVID-19, although every medical study has shown it's ineffective. The CDC and the FDA have tried to tell people that it will not protect them. And then finally, my last comment will be about universities and magical thinking. And this comes out of a more recent piece in Sapiens that I did. This is a map of coronavirus and universities around the country from the New York Times, which has been tracking outbreaks on college campuses. And you can see that it's really serious. That many universities, and especially fraternities on universities, have become super spreading locales. It's clear that universities pose a threat to the communities around them, although many university administrators believed that they could safely bring students back to campus. Now, in late August, early September, when the new academic year began, about 60% of universities were planning to bring their students back for face-to-face instruction. Many universities decided not to, but over half of American universities believed that they could safely do so by doing things like not having buffet dinners anymore, having students grab bagged lunches and dinners and eat in their dorms, telling students to socially distance in their dorms and not to have large gatherings, telling students to wear masks, reducing the density of seating in classrooms and stuff like that. It has absolutely not worked. The result instead is the complete disaster that you see in this map. So in the piece that I wrote on universities and COVID, I argue that university administrators had adopted what the sociologist Lee Clark calls fantasy plans. Fantasy plans are plans that seem immaculately wonderful to bureaucrats, but anyone with any common sense would know they're not going to work out in practice. The example of a classic fantasy plan I give in the article is that under the Reagan administration, in the event of a nuclear war, there was a plan that people with odd-numbered license plates would wait a day until the people with even-numbered license plates had evacuated the city, and then they would wait their turn, running the risk of being incinerated as they did so. No one believed that this plan would have worked out. In the article, I say that magic is often premised upon an inversion of the customary relationship between words and the material world, such that words have the power to shape material reality. We believe that if you say a spell, your enemy will die, or your relative will magically recover from the illness that she has, right? University administrators believed that these beautiful plans, 90 or 100 pages long, that they spent the summer working on, had the power to shape reality. And what really strikes me about those plans that the university administrators developed is that university administrators showed a fundamental inability to understand student culture and student life. They failed to understand the importance of drinking and sociability in large groups to many students. Now, not all students, but to many students. And you only need a certain number to become infected. And then you have an out of control pandemic on your campus. So I'll finish with these two provocative observations. Universities are supposed to represent the pinnacle of reason and insight in our society, right? They're supposed to be temples of reason, if you like. They're dedicated to rational thinking. And yet, they've behaved profoundly irresponsibly and fundamentally misunderstood the dynamics of infection in their own communities. And universities are supposed to enrich the surrounding communities. Instead, they posed an enormous danger to them in places like Madison, Arbor, and so on, threatening them with infection and even death. So I think there's some real soul searching that people in universities are left to engage in at the tail end of this pandemic. So I'm going to stop showing my slide and be ready to take some questions.
Thanks very much, Hugh. I have one on the university issue. I agree in general, though the college where I taught for many years, Williams, and several other small liberal arts colleges, I think have had a greater degree of success because they're isolated. And in some cases don't have fraternities. In the case of Williams, they abandoned fraternities 50 years ago. So it's much easier to control students. And also it's important to say that Williams has the resources to test everybody on the campus, faculty, staff, students, once a week, and turn around the results within a day or two via a laboratory in Cambridge, Mass. So I don't think you can say that it's absolutely the case that it's irresponsible, but certainly at large universities where students live off campus and so on, the risks are just, much higher. But I guess that leads into a broader question, which you addressed tangentially. For one thing, it is the case, and I'm sure you know this, that colleges and universities derive a lot of their cash flow from not just tuition, but room and board for the students. So that there's some evidence to suggest that, and in fact, it's already happened, that a significant number of colleges in particular have essentially gone bankrupt or face bankruptcy if they don't have students on campus, which is illustrative of the kind of trade-off between economic activity and personal safety that, is explored in the Dan Patrick comment, which is better that you die and that the economy live, which obviously is not a position that I'm sympathetic to, especially being in one of the target demographics. That said, it is true. I guess I was struck in Santa Fe by the real financial and nutritional hardship associated with the shutdown. Watching 2 miles of pickup trucks at the food depot in Santa Fe as people, mostly Latinx families, come to get the food that they can't get because they're unemployed during the shutdown. So how do you balance, and then there's emerging data that that complete shutdowns also increase rates of family violence, spouse abuse, alcoholism, drug use, and so on. So there are real costs to shutting down, which is not a case against shutdowns, but there is a kind of nuanced set of questions that need to be asked about the balance between safety on the one hand and some level of economic activity. So as an anthropologist, how do you deal with that? Where do you come down on it?
Okay, so let me say something first of all about your point about small colleges. I think you're absolutely right. Universities that don't have fraternities and sororities are probably much safer to reopen. And wealthy small colleges that can frequently test people and isolate them if they're infected, they're looking at a very different kind of calculus. I wasn't aware of Williams' situation, but Colby College, which is quite similar to Williams in many ways, was actually planning to test its students 3 times a week. And they'd signed an agreement with a lab at MIT to turn the around very quickly. They have the resources to do that. So, in a situation like that, I have no problem with the college opening. That seems quite responsible. As you observed, it is these larger state universities, like UNC, the University of Michigan, the University of Wisconsin, that were probably under enormous pressure from boards of trustees in their states, who may have tilted in a political direction of one kind or another to open. And you're absolutely right. There are enormous financial pressures on them. I think in that situation, you have to be candid with your students, with the parents of students, with professors. And you have to say, we're looking at a financial disaster if we don't open. And so we're going to do the best that we can. And if people follow these norms, it'll be safer than if they don't. Instead, you saw these university administrators behaving sort of like evangelists in a way, saying, I have the truth, we know how to open, we've brought all these different experts in to write our 90-page document, and it's absolutely safe. So they turned into snake oil salesmen rather than people doing truly honest, judicious risk assessment. I do take your point that the consequences of locking people down can be just as severe, arguably more severe, especially in certain communities, than the coronavirus itself. I guess few societies have run the experiment of just letting it run totally wild, so we don't know what the absolute worst case scenario looks like. You could argue, based on China's experience, that if you do a complete and utter lockdown, and you take care of people while they're locked down, you deliver them groceries and stuff like that until the virus is gone, and then you open. I mean, China now, life is almost completely normal there. the pain for 76 days was extreme, psychological, mental, economic. But now they have normal life, which we don't have. And their economy has just roared back to life. Now that's only possible to sustain with lots of testing, which the US has not managed to effect. That would be another strategy.
Yeah, I mean, I take your point, and it's a valid one. I guess there are two differences. One is they exercise that, it must be said, authoritarian control when there was still a geographic focal point, and we're so far beyond that now that even if the political will and ability were to, enforce policies like that in the United States, the scale of the distribution of the disease, I think, would probably militate against that. But in other words, we had a moment where we probably could have done that, and I think that moment is long past. So
no, I think we've climbed far enough in the curve that that's out of reach.
Yeah,
I often hear people say that if you're an autocracy, it's easier to do this complete lockdown, and China is exhibit A. But there are democratic societies that did very extreme lockdowns. Not all of Australia, but Melbourne recently went through something like a 2-month total lockdown in Australia. And Northern Italy, back in late February, early March, did a very extreme lockdown. It worked for a while. Now, unfortunately, they've got their numbers going back up again.
Yeah, thank you. Paul?
Yeah, I'm reading some questions, Hugh. That was a intellectually engaging talk, I have to say, but also emotionally difficult. So I'm sort of, that's a lot to take in, but fascinating at the same time. Here's a question from Linda Hull. What percentage of the world population is infected? Shouldn't those communities with the highest percentages be given vaccines accordingly?
So she would have the vaccine allocated by country according to their infection rate?
Yeah.
So I have no idea, I'm afraid to say, what the global infection rate is. I mean, I do know that the infection rate tends to be highest from what we know in Brazil, in India, in the US, the UK. So I can see an argument for getting the vaccine quickly to those. Then you have the question, who do you vaccinate first within those countries? If it were up to me, I would vaccinate healthcare workers, obviously. Anyone who's working from home, like me, would go to the back of the line. I would vaccinate essential workers, like people in meatpacking plants, farm workers, people in warehouses, supermarket workers, and so on. I would probably vaccinate people in their late teens and early 20s fairly early on, because we're learning that they're the ones most likely to become infected, and they become vectors of infection to their families. So a good way of protecting someone my age is to vaccinate my 18-year-old son.
I've got a question. As you're living in Canada, my understanding was, at least until very recently, Canada's experience was vastly superior to that of the United States, culturally similar, but obviously politically quite different. Some of the conditions that you talk about, like a completely fragmented healthcare system, does not apply to Canada. And yet I just looked at the Canadian data this morning, and certainly there's a sharp upward trend. So how do you account for that? What do you think the Canadians have gotten right, and what are they not doing now?
So I have a colleague at UBC who writes about COVID, and she argues that Canada's policy is not so different from Sweden's policy. Sweden has really been heavily criticized for going for what people call a herd immunity policy, though I don't think that's quite fair to Sweden. But they certainly didn't do any lockdowns, and they let kids keep going to school all through the year. In Canada, my 13-year-old daughter goes to school every day. She has to wear a mask. It's only for 2 hours a day. She has to wear a mask. All the other kids wear masks. The teachers wear masks. And they're not allowed to play sports or to linger on campus. The universities, on the other hand, are locked down. So the University of British Columbia is all remote teaching. The restaurants are open. People are eating inside restaurants, going to bars, which I'm opposed to. I would have restaurants be takeout only, and I would close the bars, but I'm not in charge. The rates are, as you say, going back up in Canada. It partly has to do with Thanksgiving, which was about a month ago in Canada, and people traveled around the country, got together with families. It has to do with Halloween, where people get together and let off fireworks in groups. So we're seeing some escalation from that. It has to do with the weather getting colder and people moving back indoors. So British Columbia, where I live, announced new emergency measures 2 days ago, where you can only eat in a restaurant with your own bubble. You're not supposed to have anyone come over to your house, even to sit outside on your porch for the next few weeks. So there have been a number of limitations. What I notice is that in Canada, they don't so much issue orders as exhort people. So Bonnie Hendry, the chief medical officer of British Columbia, who's become sort of an iconic figure, keeps exhorting people to be considerate of others around them, to think of themselves as a potential vector for the illness, to wear masks, not to congregate. And so she doesn't say, I'm ordering you to wear masks inside. In some stores have signs that say no mask, no entry, others don't. It's sort of left up to individuals and communities, but people on the whole end up doing the right thing more than they would in the US. And partly it's because it hasn't become a political football. The politicians, no matter their party, all agree that this is what should be done. And I think there is more of a communitarian ethic in Canada, where people think of the implications of their own actions for others. Whereas in the US, there's this sort of libertarian ethic run wild. And you see it in people's obstinate refusal to wear masks, how people throw temper tantrums if they're asked to wear masks.
Yeah.
Answer your question?
Well, my comment is that, then they say, well, I'm defending my constitutional rights, and my view is, I don't recall the Constitution says we're obliged to wear clothes in public, but we do, and we are. I don't see why wearing a mask is some vastly more burdensome requirement or expectation. Anyway, Paul, do you have a question?
Let me just add one statistic, by the way. You said the cases are going up in Canada, and they are. So at the moment, in the province of British Columbia, it's 500 new cases a day. I think it's roughly twice that in my county in Maryland that I left behind.
Sure.
So 2 weeks ago, it was 100 new cases a day. Now it's 500 cases a day in British Columbia, but it's still small compared to the US.
Right.
We have a question from Marty Bartelt. From an anthropological point of view, what needs to happen to overcome the magical thinking or inability to imagine the threat that the US is experiencing?
That's a really interesting question. Magical thinking is not always the enemy. I mean, there's something magical about a vaccine, right? If we can get people to believe in vaccine magic, you don't have to overcome magical thinking. You can catch a ride on it. But I think it's really important that political leaders and public health leaders are all on the same page, that they all agree on the same message. So it's really important that they say wearing masks protects you. Don't call them face diapers, call them masks, and show some consideration for your neighbor by wearing them. And it's important that you see TV commentators on Fox and people like that saying, no matter what you read in some little corner of the web, hydroxychloroquine will not protect you. And it would be wonderful if evangelical preachers could be brought in to spread the word as well. So if I were asked by the incoming Biden administration for advice on what to do to help tamp down the pandemic, one of my pieces of advice would be to reach out to the evangelical community, put them together with public health people, instead of treating them as ignorant yokels or ignoring them or treating them as the problem. Bring them into a conversation. See if you can enlist them in becoming advocates for public health measures. The problem is, of course, the social media environment. Unless Facebook and Twitter are willing to completely ban the 10% of their messages that spread fake cures and so on. It's really hard to get a handle on this. So I think what makes this pandemic quite different from previous pandemics is the infodemic that goes with it, the infodemic of phony information that becomes really, really hard to combat. And people are really sort of crammed into their isolated niche information communities. I'm aware that what I read on Facebook is not the same as what other people read on Facebook. Their Facebook is totally different from my Facebook. They're inhaling information I have no idea. In as complex and subdivided an information ecosystem as Facebook, I don't know how you're going to handle this. But somehow social media has to be tamed, I think.
I've got a question, Philip Goldstone, who sends his regards. And he says,
Hi, Philip.
I'm noting that the population normalized case rates in European countries with varying cultures are as high or higher than the US population normalized rates. Though you focus primarily on the US, and I agree with your points, what are the comparisons with the Czech Republic, France, Spain, et cetera, suggest to you?
Yeah, I wish I knew more about the dynamics in those countries. There is some evidence that in populist countries with populist governments are not doing it all well. So the UK under Boris Johnson is not doing well. Hungary is not doing well. Belarus is not doing well. So that may be one risk factor. I'm puzzled by the Czech Republic. I don't know what their numbers are exactly, but they adopted masks quite early. So I don't know what went wrong in the Czech Republic. To me, looking at Spain and Italy, they got overconfident. They came out of their lockdowns and they said, okay, we beat this, we're free from it. And they didn't take enough precautions.
So is Sweden considered, it's funny, is it considered a failure or a success? I mean, the media are all over it. I mean, one week I say it's a great example of how to handle it, and the next week it's like they have the worst data in Europe. So I'm not sure I know how to understand it.
I don't think they have the worst data in Europe. I don't think they're doing as badly as the UK, actually. They're certainly doing worse than their Scandinavian neighbors. I mean, one way of thinking about Scandinavia is as a sort of cultural bloc. And the countries in the bloc have chosen different health strategies. And so you can see within that cultural bloc which strategies work better and worse. And there's absolutely no question that Denmark, Norway, Iceland are doing much better than Sweden. On the other hand, Sweden is doing better than the US, and I think it's doing better than the UK. And I think you have to realize that they're a culture where when people are told, be responsible, don't congregate in bars, they say, okay, I won't congregate in bars. And people are being told to socially distance even when they gather together.
Thank you. Paul?
Here's a question from James Bryant. It seems the third issue, magical thinking, the third issue of your presentation, underlies all the others. Resistance to science and other avenues for understanding nature promotes disease spread. I guess if you could comment on that, do you think that the magical thinking underlies all the other issues?
I don't want to privilege one over the other. It's sort of entangled with everything. And I also want to be careful, especially since I'm speaking in New Mexico with its large science community, not to feed the ego of scientists too much here. So maybe it's worth reminding people that some of the leading scientists got things quite wrong early on. Fauci, I have a little video clip of him telling people not to wear masks, that it was crazy to wear masks. They didn't do anything at all. That's back in February or March. He changed his mind, right? And if you remember, there was a time when we were being told to scrub the cereal boxes when we brought them from the supermarket and to leave the mail in the sun for 3 days so that the virus would die on the fomites. Now, I appreciate that, all scientific knowledge is provisional and scientists keep questioning established knowledge and they keep revising it. That's what they did. But early on, we were told things that turned out to be quite untrue. We were told that aerosols were not particularly dangerous, that it was heavy droplets that mattered. Completely changed their mind about that. We were told not to wear masks. They changed their mind about that. We were told surfaces were the most dangerous thing. It changed their mind about that. So in the early days of the pandemic, scientists were part of the problem with some of the advice that they were giving. They were giving good advice along with bad advice.
There's also that classic anthropological issue of, that Evans Pritchard taught us all of thinking about the coherence of magic as a way of understanding the world. Why did the granary fall right then when we were under it? Just because our explanation sounds magical from the outside to us, it doesn't mean it's an incoherent explanation, right? So as anthropologists, perhaps. There's more questions.
And part of magical thinking is, believing in magic potions. And unfortunately, the internet has made it possible for cynical and unscrupulous people to spread wildly untrue rumors about supposedly magical potions that will enrich them and not protect anyone. I guess this is part of magical thinking, that many religious communities have conveyed the sense to congregants that you should put your faith in Jesus. And so if you don't come to church because you want to socially distance, you're not showing faith in Jesus, right? And so we really need pastors to tell people Jesus is part of being faithful to Jesus is realizing that he gave scientists the insight to share with us so that we can protect ourselves. Jesus wants you to know that we've discovered that wearing a mask will protect you. Jesus wants you to know that keeping a distance from people will help you to protect you. That's why he made it possible for scientists to discover that knowledge. So if there's any way to get Christian churches to move away from the sort of snake handling ethos, where you do something really dangerous like handling snakes to show that you are without sin and you have true faith in God, and move towards thinking of science as itself a gift from God.
But to what extent, I buy your argument about magical thinking, Hugh, but to what extent does this reflect a broader problem of just populist rejection of elite knowledge and elites in general? I mean, that's more of an issue in climate change, which is also driven by science, but other aspects of, foreign relations. I mean, we shouldn't have professional diplomats anymore. We should just have people going by the seat of their pants. I mean, isn't that part of what we're dealing, at least in the United States, what we're dealing with?
Yeah, to the best of my knowledge, that skepticism isn't as extreme in most European countries. I have a colleague here at the University of British Columbia who just published a book on nuclear waste disposal in Finland. And he did extensive fieldwork in Finland. And what struck me about his book is the extraordinary faith that the Finn on the street puts in his or her scientific experts. They decided that nuclear waste disposal was an issue they wanted to leave to the experts. Whatever site the experts picked, they trusted them to know what they were doing. It's really hard to imagine a process and an outcome like that in the United States, right? So skepticism of experts goes with populism. We're going through this populist moment right now. And I think you have to ask, whose purposes does that skepticism serve, right? So it's quite clear that when you talk about skepticism about climate change, there are very wealthy interests that have poured huge amounts of money into cultivating that skepticism, endowing professorships for earth scientists who question climate change, paying people to write columns that will be published in newspapers, questioning climate change and so on. So there are powerful interests out there that are their own kind of elite. They're a financial elite that are enculturating us to question scientific experts when it suits them. And I'm afraid to get too party political here, but the Republican Party has learned that one stratagem for gaining power is to manipulate that kind of questioning of elites.
Sure. Yeah.
And to refer to the Democrats as these people who just want to lecture you all the time on giving up your gas guzzling car and not eating what you want to eat.
Not having windows, or what was that story?
Tiny Biden window, right?
Paul?
I've got a question here from Susan Davis, very interesting, different topic. She writes, I have a question about risk perception. I think we are all familiar with people who think they are safe because they only know apparently healthy people. People say that the people they know or the places they live are quote unquote clean. Is it possible that the social stratification we live with, both racial and economic, distorts our perception of risk? Another way to say this is to ask whether risk perception, or the ability to imagine the risk of the virus, is shaped by economic privilege.
It's shaped by economic privilege and by what's visible and what isn't visible. So, if you're surrounded by people who appear healthy, even if 40% of the people infectious with coronavirus don't show symptoms, it's easy to be lulled into a false sense of confidence, right? So there is that. Medical anthropologists who worked with STDs have observed that people will say, well, the guy I met in the bar, he had a BMW and he had a beautiful apartment and he wore this really nice suit and he was well educated. How could I have possibly thought that he would give me an STD? So there's this common confusion of appearance and risk. But I think in the case of class, there's absolutely no doubt this comes into it. I wish I could remember the exact quote, but early on in the pandemic, there was a super spreading event at a meatpacking plant in either South Dakota or North Dakota. I think it was South Dakota. And a prominent political figure was quoted as saying that people didn't need to socially distance because it's only people like that were spreading the virus, and we don't mix with people like that. Meaning, primarily African and Latinx people who were working in the plant. But it's easy to forget that when we go to the supermarket, we rub shoulders with people like that. They're our supermarket checkout cashier, right? If we're on public transport, we may rub shoulders with them. If we go to the doctor, we may sit in a waiting room with them. Our lives intersect theirs more than we may think. But I think absolutely the sense of sort of immunoprivilege that I've seen in some wealthy Americans, I think is absolutely sort of class-based. The sense that the pandemic is running riot among the wrong kind of people. And in Madrid recently, they actually tried to lock down only the poorest parts of Madrid. They said that the danger of the virus was that it was being spread by the poor people. So they're going to let the rest of Madrid carry on as normal, but just lock down the poor parts, with the exception that the people who were coming to clean the houses of the rich people would be allowed through the barricade if they showed a letter.
We're running out of time here, so we're probably not going to be able to answer all the questions that have come in. But Jimmy Allen asks, can you speak to vaccine and reluctance to receive vaccine? You haven't talked about anti-vaxxers and how that's likely, how that view is likely to play out in the coming months. Do you have any thoughts on that?
It will partly depend on the messaging around it. Not completely, but partly. So for example, if President Biden were to broadcast himself getting vaccinated live, that might help people. It would really help people if Donald Trump would broadcast himself being vaccinated. But I think there's an outside chance of that. If he wants to take credit for the vaccine, maybe he wants to show himself being vaccinated. It would do a lot more to encourage other people to get vaccinated than showing Biden getting vaccinated. So there is the matter of example. You can use coercion to some degree. You can say, if you can't show a certificate of vaccination, your kids are not going to school, your kids are not going to university, you can't get a job in this workplace. So when the vaccine is freely available, you could do that. It also depends sort of on the luck of the draw. There was an incident when the polio vaccine was released where there was a bad batch.
Yeah.
It gave polio to 100 or 200 kids. And when I look back on that, it's remarkable to me that people went ahead and still got vaccinated against polio. If something like that were to happen when the vaccine is rolled out, if it were to cause a little cluster of cases, then I would fear the worst. So we have to hope that nothing like that happens. In terms of anti-vaxxers, I had a student who wrote a paper for me on anti-vaxxers, and they're a very interesting community. Some of them are very organic and green and liberal, and some of them are sort of right-wing and more sort of down market socioeconomically. So there's this very interesting melange of sort of privileged organic elite greenies and, if you like, your sort of stereotypical make America great again kind of person. And I went to an anti-mask rally in Vancouver a few weeks ago, and you could see this quite clearly. There were a few people with Trump flags and neo-Nazi biker jackets and stuff like that. And then there were other people who looked as if they just walked out of Whole Foods.
Interesting. Thank you.
Do we have time for one more, Michael?
Sure, absolutely.
Okay. This is from Louise Lamphere. She writes,
Hi, Louise.
I just read an article titled Immune Disorder in the November 9th New Yorker that lays out the complexities of the immune system and COVID. It makes clear that the immune systems of people over 60 and especially over 75 slow down, work less effectively, and have a more difficult time dealing with the COVID virus. How does this fit into your comments of COVID Darwinism and how the vaccines might be distributed?
Well, assuming that it's true, I haven't read the article, but it does fit with my impression. Assuming it's true, then obviously people over 60 and especially people over 75 are at much greater risk of a really bad outcome, like death or permanent disability if they get COVID. And you can imagine, if you like, that we're at a fork in the road where the vaccine is becoming available. And there are still discussions about whether to require masks and how much social distancing to impose. So on the one hand, there's a society I can envisage where older people would have relatively early access to the vaccine. The vaccine will not be a cure-all. It will take a year or a year and a half for the vaccine to reach enough people to confer herd immunity, assuming that it is effective. So in that period of time, people will still have to socially distance to some degree, and they will still have to wear masks, or life will continue to be unpleasant with a high death rate. So I can envisage one society where you give early access to the vaccine to older people, and younger people, out of concern for their grandparents and their parents, continue to wear masks and to restrict their social lives, maybe not to eat out in restaurants and go to bars as often as they did before. Not extreme, absolute lockdown, but a sort of modified lockdown, if you like. And that would protect those people. On the other hand, I could imagine a society where you say, look, these people don't have many years ahead of them anyway. If we want to get maximum leverage out of this vaccine, we should give it to younger people. We should protect them first. And we should hope that if we protect them, they won't infect the old people. But the old people are not going to be around that much longer, right? And they soak up a lot of money with Medicare and Social Security. They're not contributing much to society. You know, if we're going to get society back on its feet, we have to prioritize protecting workers or get the factories going again. And the old people, well, you know, they'd be well advised to stay in, not to go out too much, and to be careful to wear a mask if they go out. So that would be the other alternative. I guess the question before us is which sort of society we want to be, which sort of society we will be.
Well, on that sobering note, I think we probably should end, but Hugh Gusterson, thank you so much for an engaging talk. We really appreciate your willing to do this. I must say, we wish you could have come to Santa Fe, but as you know, we're still mostly in a work from home situation. You can tell I'm not in my SAR office, but we're engaging a lot more people than we did with the in-person events. So in that sense, it's been an encouraging experience for us. A lot of scrambling on the technology side, but we're really all in on events like this, and it gives us a chance to bring people into conversation who probably wouldn't be able to take the time to come to Santa Fe. So again, thank you very much. Thank you, Paul, for helping out with the questions, and I'd like to thank everyone who joined us and who posed such good questions, and apologies for those of you who didn't get your questions answered. With
And
that,
feel free to email me if people want to follow up with an email.
thank you, and goodbye to everybody.